The practice whereby doctors see patients, then recommend that patients be transferred to the University Hospital of the West Indies, the UHWI, has been put on hold because of what the UHWI says is a severe space constraint. But the opposition have come out with all guns blazing. They say that it is not true that it's a space constraint issue. They're saying it's more serious than that, and it is cause for the government to declare a state of public health emergency. We'll hear from the opposition spokesman on health, Dr. Alfred Dawes, and then later on in the show, we'll hear from the woman who is the new PNP standard bearer in Central St. James, Senator Janice Allen. Lead story on this Friday. Let's start the show. Welcome to Lead Story on this Friday. The issue concerns health at the top of the ticket, and the government, well, through the University Hospital of the West Indies. I'll read their brief statement sent on Thursday. Today's Friday, of course, and on Thursday. This statement says, due to the impending passage of Hurricane Beryl, well, that's not the statement. I have the wrong statement. But actually what the statement did say on Thursday was that patients who would normally be seen by their doctor and then referred for transfer to the University Hospital of the West Indies, that practice is on hold. The UHWI says it is out of space. The medical chief of staff at the UHWI, Dr. Carl Bruce, has been telling the media that, look, we have run out of space because of how overwhelmed the hospital is by persons who are suffering from NCDs, non-communicable diseases. So you're talking about the diabetes, the heart-related issues, all of these issues. Patients with these issues, these chronic illnesses, are overburdening the system. And so they have to be mindful of the fact that emergency has to have some capacity to accept emergency cases. And so they're leaving some space in the facility for these patients who need emergency care, freeing up beds for them. Well, not freeing up beds, leaving beds to be available for these emergency cases. And they're saying to doctors, look, for the time being, we would ask that you transfer those patients that you would ordinarily send here for treatment, send them somewhere else for the time being. That has not gone down well with the parliamentary opposition, which, through its spokesman on health, Dr. Alfred Dawes, says it is a far more serious issue, demanding of a declaration of a state of public health care emergency. Dr. Dawes is with us this afternoon. Good afternoon, Dr. Dawes.
Hey, good afternoon, George. Good evening. Good afternoon to all the viewers.
Thank you for joining us. All right. So what do you understand the issue to be, and how different is it from what has been communicated to the country by the UHWI management?
Well, you have to look at the presence of only 3 Type A hospitals in the island: Cornwall Regional, KPH, and UA. These are the only 3 hospitals where you can get certain type of specialized care. And for the other Type B and Type C hospitals in the rural areas, it is the referral center where the sick patients or patients who are in need of specialized care are sent. With Cornwall having issues, and I can bet you a lot of the patients at UA now are from Western Jamaica, because when Cornwall is up and running, you would have Cornwall as the main referral center. Now, and I can speak from my experience when I was at Sablamar Hospital, the majority of times we end up sending patients into Kingston when the air quality issues began at Cornwall. So with Cornwall down, you're pretty much left with UA and KPH. And with UA out now, you're left with KPH, which is already bursting at the seams with all of the trauma that is there. So when you look at the whole picture, not just at the bed capacity at UA, but at the island public and private healthcare system, you're realizing that if you run into trouble with any patient at all, your only option is to transfer to KPH at this time. So we cannot have anyone believing that, well, since UA can't take patients it's temporarily just sending them elsewhere. That elsewhere is only one hospital, and that is KPH.
So Dr. Bruce, the medical chief of staff at the UHWI, was at pains earlier today to point out that it is not a doctor shortage issue, but that based on the trend analysis, this was a necessary move at the time. He also pointed out, Dr. Dawes, that the situation assailing the UHWI at the moment is not unique. He said that there are medical facilities in the UK and Canada where this situation is now being realized, brought about by COVID, and how many people stayed away from getting treatment with their NCDs, and how those NCDs have gotten progressively worse, and people are in trouble now, necessitating the kind of medical help that causes them to be crowding out facilities like the UHWI. Do you accept that reasoning from Dr. Bruce?
Well, I will even go further with that reasoning, that primary care has been dealt a death blow with COVID because a lot of people miss their appointments, and their diabetes have been out of control, the hypertension has been out of control. So immediately post-COVID, what should have been done was to focus on primary care. COVID is 2 years ago. If we had spent the resources that we had putting up a lot of infrastructure on primary care, then it would have been a better bang for the buck. And I maintain that any overhaul of the healthcare system must be with primary care.
Yes.
The UK, they have their clinics, their emergency departments overrun now with prolonged waiting times, and their primary care physicians are booked out because of the issues that they have with the National Health Service. But countries that have invested in their primary care are not seeing this issue.
Yes.
And this is something that has been pointed out time and time again to health authorities here locally and in other countries that are focused on more advanced care. You have to go back to basics. If you look at a country like Thailand, where they spend one of the lowest GDP per capita amounts on health care, compared to the U.S. that is like 17,000 per year. They have a robust primary health care service. Cuba has a robust primary health care service, and it is paying dividends. But we cannot keep focusing on spending dollars on rehabilitation, painting clinics, cutting ribbons, putting up buildings that are going to be empty without focusing on primary care, because it is chronic diseases that are causing the issues.
Yes.
And this is why we are in this position.
Yes.
Now that we are in this position...
Hold the point there, Dr. Dawes. Hold the point there, Dr. Dawes. Dr. Dawes, I must take this break. So hold your line of thought. We're going to pick up after these. This is Lead Story here on CVM TV. Experienced medical professional Dr. Alfred Dawes is my guest. He's the opposition spokesman on health, and he is talking about the announcement by the UHWI that doctors and facilities, even senior nursing homes who would ordinarily send patients to the UHWI for care and treatment, ought not to do so for the time being due to a space constraint. Dr. Dawes says, well, that's not good enough, and that the government ought to have seen this thing happen, especially with the suspension in care occasioned by the COVID-19 pandemic. But he says the amount of time since the pandemic eased should have caused the government to put their house in order to not be in this position at the premier healthcare facility in one of the premier healthcare facilities in the English-speaking Caribbean. So, Dr. Dawes, if we are to go by your reasoning and your call that a state of public healthcare emergency ought to be declared, how would that begin to remedy the situation facing the management at the UHWI?
Well, this is the situation. Your outlet has a bottleneck now whereby it's only KPH that is accepting the patients who would need transfer. You're going to have your motor vehicle accidents. You're going to have patients with head injuries. Is it that you're going to now issue an order that all elective cases, elective surgeries, island-wide be suspended? Because if you're running a situation where you have a complication and KPH now cannot accept that patient, that is a problem. I am in the private sector, and if I have a patient who has a complication, they're still going to UE or KPH. That is going to affect my practice, and my practice is only a small one compared to all of the other hospitals that are providing surgical, general surgical, neurosurgical, orthopedic, as well as gynecological operations daily. So if we're going to continue, if it is business as usual, and you're going to have complications, if you're operating, you're going to have complications, otherwise you're not operating enough. It is going to happen. What is going to happen now when you have all of these patients, and you have 20 hospitals plus several private hospitals where patients are being seen, and they're being in a situation where they can't be cared for in those facilities. They must be transferred to a type A hospital, and it's not necessarily to an ICU, where the UA has the majority of the ICUs accounted for in the island.
But Dr. Dawes, I only have
specialized service.
Dr. Dawes, I only have 3 minutes left, and I hear you. Listen, I don't think anybody watching this program this evening requires any more articulation on what the problem is. You've done that brilliantly. I want to hear from you. What would the declaration of a state of public health care emergency, how would that help to remedy the situation is what I'm asking.
This is what I'm saying.
Yeah.
You have to try to scale back elective services and then look at how
is that a real option, scaling back elective surgeries?
Any hospital who is having issues, when theaters go down, when you have a lot of emergencies, they scale back and go to emergency only.
Oh.
You cannot continue to operate. It happens all the time.
Yes.
But you have to look at what's happening. You cannot be doing neurosurgeries and high-risk patients, elective surgeries at this time.
Yes.
You have to issue something because it is a risk that you're putting those patients in because they only have one institution they can go to. The other thing is that case managers need to go into UE and find out for every single patient on every single bed, what is it that's keeping them now? Is it some results that they're waiting on? Is it some equipment they need for a procedure? And get everything done right now. That is the role of a case manager. It works very well in the North American private healthcare system, and it is something that we have to put in place here in order to address bed management, because bed management is an issue right now. So get those people out of the hospital as soon as you can in a stable state, and you get all the results they need, all the tests, all the procedures.
Yes.
Start them on all their medications, no matter what the cost is. Because right now, we are in a dire emergency.
Yeah. Doc, my producer recognizes that we have more ground to cover and we didn't have enough time, so he's granted me a few additional minutes. Stay where you are. I want to continue the conversation after the break. This is Lead Story here on CVM TV. Dr. Alfred Dawes says there are practical steps the government ought to take now to free up the bottleneck at the UHWI, which has caused the institution to tell doctors and institutions not to send patients there who would ordinarily be transferred for health care and for treatment because they simply don't have enough space. Dr. Carl Bruce, the medical chief of staff, says even the facilities that were built outside of the regular brick and mortar plant for COVID to accommodate patients, even those areas are full, and they want to keep a certain number of beds available for emergency care patients. He was at pains to say as well that, look, if the message is not that persons should not come to the UHWI for treatment in the case that they have an emergency. He's saying that you are welcome to come. And he's saying it is for those people that they're trying to make space, while they've given this communication to medical doctors across the island, doctors at other health facilities who would usually send patients up to the UHWI. But the opposition have said that's not good enough, and there are practical solutions that can be implemented to effect the requisite change. So here's where I'm going now in the dying embers of the program, Dr. Dawes. For those doctors at the facilities that are used to sending up patients to KPH, you see Miss Matty, and you look at her condition and you say, no, you need to go to the KPH. You see Ma Storm, and the same thing applies. What are they to do now? What are they to do with the patients who won't stop coming and who won't stop presenting with the illnesses and the state of the illnesses that would warrant them being sent to a place like the UHWI?
You're a tough interviewer, George, and that is a question that you're asking me, that it will take a whole panel of experts to sit down and discuss how you're going to solve that problem. Because, as I said, you have 20 hospitals that are continuing to function outside of those type 3 hospitals. You have private hospitals with surgeries going on and people being admitted electively and for emergency. You have nursing homes where patients are going to be deteriorating and they need to be sent. So if they're not going to be transferred to UWI, and everybody across the entire island now is going to be transferred to KPH, it's just a matter of time before KPH itself gets overburdened. And what's going to happen at that time? But that one, I don't have the answers.
Yes.
It's a very difficult problem.
Yeah.
It's sad that we are in this position, and it's going to take a lot of collective reasoning and listening to people and accepting that we are in a crisis. The first thing we have to do is accept that we are in a crisis.
Yes.
And only then can we take tangible steps to alleviate that crisis.
Right.
And that's where it ought to begin.
I'm intrigued by the measure you proposed before the last break to say, look, what needs to happen in the immediate term is for, my terminology now, a bed audit at the UHWI to be done immediately. But one would expect that even without the healthcare emergency declaration, that Dr. Carl Bruce and staff will be doing that right now.
Well, it's a step further than just a bed audit.
Yes.
So there's a role that I've been investigating, and I'm giving away one of my manifesto items. But there's a role that is called a case manager in a lot. So many of these for-profit healthcare systems in the U.S., the longer you stay in hospital, the insurance is not going to pay beyond a certain time, and they start to incur a loss. So it suits them for you to get better and get out by day 2, day 3.
Yes.
And what they have is that they have employed someone who will go through, not just do an audit, but they will find out exactly what is keeping it. If it is a doctor who needs to come and discharge a patient, they get that doctor on the phone or a representative to come and deal with whatever it is. If it is a medication that is needed, and in our case, it might be a medication that the relatives are putting money together to buy, we provide that medication so the patient is started on that medication. So it's not just an audit, but you put in the interventions that are necessary to get that person up and out the door. It's going to cost the state, but what is you cannot put a value on the human life that may be saved by that person going home and somebody else sick or having access to that bed.
Yeah.
And that is where I'm saying it has to be a step further than just doing a bed audit.
Yeah. And fret not,
actually do what is needed to get them out.
And fret not, Dr. Dawes, nobody can touch that point because this is on record, and you are on record publicly as being the first man to tout this thing of the case manager. So fret not about that. Here's the thing, though. People hearing you are wondering, okay, So what's the true position as a former PNP Attorney General used to say, A.J. Nichols, what's the true position? What's the true position where Cornwall region is concerned? Why it can't help KPH with the expected load that's going to be put on it now?
I mean, you know, when the issue started, it was a scope creep. There was a lot of mismanagement, a lot of mistakes were made, and then the decision was taken to basically gut the building and go again. You know, history will determine whether or not that was the correct approach, but many are of the opinion that we should have just gotten Cornwall Regional back operational as soon as possible, and then look at the construction of a new hospital. Because the pumps, or we'll be looking to pump 20 billion, you know, even though some of that fund was supposed to be fixing up other hospitals, a sizable portion of that money was spent on a hospital that is 50 years old. So with Cornwall down, it has put pressure on the entire Western Jamaica. Falmouth Hospital is bursting at the seams, Sab Hospital, Lucy, and you're always going to hear horror stories coming out of the West, not because of a lack of willingness or trying from the management or the workers, but because of just the resources that are there. And it's very unfortunate. But then what happens is that the West now transfers patients to Kingston. So whereas Cornwall would have had maybe 7 or so ICU spaces, they're down to about 2. So everything else is going to Kingston, and if it's not KPH, it's UA. And as much as UA has, you know, they're collecting some amount of money, they're still in a huge hole. So the maintenance of their equipment and so on, and they're suffering just as the rest of the island.
Yeah.
From migration.
Yeah.
So the whole health sector, and it's unfortunate that with you know, all of these issues, COVID hit, and as I said, and Dr. Bruce, I concur with him fully, we had a gap where because the clinics were shut down or limited, people's diabetes, blood pressure, cholesterol, and so on were not being taken care of. So now we're seeing all of that coming out. But then, you know, we missed that boat where we should have invested all of the resources in primary care coming out of COVID to try and catch up. But right now we're left with damage control and how do we plan moving forward.
Hear you on that. Thank you very much for your time this evening, Dr. Dawes. Always a pleasure. All the best to you.
Same.
Good. Dr. Alfred Dawes, the opposition spokesman on health. We take a break here on Lead Story. When we come back, I'll give you my perspective. Take one. George's take. So hear me now. Having listened to Dr. Carl Bruce, the medical chief of staff at the UHWI, I understand clearly why the hospital was moved to issue this notice to the public. Because in real terms, it was not that the public needed to hear per se, it was that the doctors at the facilities who send their patients on to UHWI they are the ones who really ought to know, because they're the ones who make the referral for transfer. So it's really a message for them. But the UHWI, of course, the public represents their customer base, so they have to tell the customer base that this is what we have told your doctors to do. This is how they should operate. I understand that clearly. I see the position he's in. He's not lying, Dr. Bruce, when he says it's not a situation unique to Jamaica in this post-COVID environment. But I'd like to see a lot more on what Dr. Dawes has suggested, whereby you have this care service individual who does this assessment to find out the state of wellness of the patients occupying the beds in hospital, to determine if they can then free up a bed to get somebody else in. I think that that's a part of the solution going forward. I have no doubt that the management at the KPH and the staff are doing that as we speak, or seeking to do that in the right now, in the immediate term. It's a problem that can get worse, because as Dr. Dawes has asked, what if with the weight of transfer to KPH causes the same thing at the UHWI to set in at the KPH? Where do the patients go? And so elective surgery, so you were due to go do a hernia, or to cut a hernia, or to do something, the ladies with the problem with the fibroids, whatever, those surgeries will perhaps, at the worst case scenario, have to be delayed, and only emergencies. So a man comes in with a gunshot, a man crashed in a car and mash up. Those are the cases that will have to take precedence because of the lack of space and the availability of beds to help with the convalescence of a patient. It need not be a political issue. Those who are in the know need to speak to each other, share the best ideas, and implement them, because we are here at the situation. The UHWI, I'm sure, has taken a proactive measure, which isn't all that palatable, but it's a proactive measure. But it can get worse without the proper management. And I wouldn't want to be here if that problem got worse and I or my loved ones had to go to the hospital, had to be referred by a private doctor to the UHWI, because that means our corner would be dark. Yeah? So I'm suggesting that Dr. Dawes, Dr. Bruce, and those in the know get together to work this problem out. It will take nothing from anybody politically to assist the healthcare process at this time. That's my perspective on this Friday. Have a good weekend, and all things being well, I shall see you on Monday. Is the all-girls squad of Curlin and TK that will be rolling in for the news at 7.